In this next segment, I want to talk for just a minute about the distinction that I make often between health finance and health care. And on one hand, we're talking about payments, and on the other, we're talking about patience. And those two, they go together, and you have to be able to pay for your health care. But often, and I think this is one of the pitfalls of the debate as it's proceeded over the last year, is that we've said the word health care reform when in fact we're talking about health finance reform. And it's important to keep those two definitions separate so that we don't confuse one for the other. As I spoke about earlier, just having health insurance doesn't guarantee that everything's going to go well for you. And it certainly doesn't guarantee that everything's even going to get paid for in a seamless way. So I think that, as far as finding common ground between the varying positions on this healthcare debate, one thing just about everybody, except for the most obstinate among us, agree that we are in the midst of a healthcare system, that our American healthcare system is broken. Now, and we hear that sometimes, but the question I think we have to ask ourselves is what does that mean? And to me, what it means is that the quality of our healthcare is too low, and the cost of our healthcare is too high. In other words, it's a bad value. Sort of like if you went to a restaurant and you ate a paper-thin steak, and the restaurant was dingy and dirty, but it still cost you $40 or $50. That's a bad value. If you go to a restaurant and they have great portions and it's delicious food, wonderful service, and you get out of there for less than $10, that's a great value. And we experience that not just in healthcare, but in any other part of our lives. We've got Amy and I have a good friend who could redecorate your home for about $25 and a gallon of paint so that it would be ready for the cover of Southern Living. And she understands value. Now there are people out there who pay tens of thousands, maybe more, for interior decorators and designers, and sometimes you walk into those homes and go, ooh, that was tough. Maybe not a good investment. So again, they didn't get the value out of it. So we have to remember that when we're talking about healthcare, we're talking about an issue of are we getting value out of our healthcare system? One of the reasons that healthcare is so expensive is because of the high value that we place on it. It's our health after all. And even when everything else is crashing down around you, and especially as you age, you'll hear folks more and more say, well, at least I've got my health. Because you realize that that's one of the fundamental things that makes life worth living. And on that note, what we've got to ask ourselves, again, we've got to ask ourselves, I think, a lot more hard questions than we do. One of them is, how much is my health worth? How much is your health worth? And that question can, we might be able to answer it. It becomes a little bit more difficult whenever you start to say, how much is your spouse's health worth? And I think that really, that question in particular leads us to the conclusion that, ooh, I would pay anything. I'd mortgage my house 50 times over to make sure that my spouse was okay. And that's part of the challenge that we face with healthcare, is that regular economics fly out the window when we're talking about somebody's life and quality of life. And that's where I want to go from there. We've got to also ask ourselves, what is the goal of healthcare? And the goal of healthcare, at least as I see it, is excellent quality of life. That it really is it's an issue about quality of life. And so when we're sick, our quality of life suffers. And this again ties into the Declaration of Independence, that we have these unalienable rights of life, liberty, and the pursuit of happiness. And all those things are tied together to our quality of life, our opportunity to better ourselves and to better our family's life and the life of our children. So if the quality of healthcare increases, then in that scenario, fewer people get sick. The people who do get sick get well quicker. Those people with chronic conditions get the help they need to manage those conditions and to maximize their quality of life. And so coverage, healthcare coverage and healthcare finance ultimately is instrumental to health care. And the goal is health care. So I could have great coverage and still have terrible health care. And so the question we have to ask ourselves again is, how does the model of coverage that we choose to employ, how does the model of coverage increase the quality of care? And so when we're paying for our doctors' training and their expertise, we're paying for the technology and the facilities at the hospital, all that stuff. There's a lot of details in healthcare, but I want to make sure that we crystallize this idea that we're making sure that our coverage model is increasing the quality of care that patients are receiving.